Seniors, beware! 9 popular medications that trigger rapid dementia. It's a sobering thought that by the time you finish watching this, approximately 20 seniors will have received a dementia diagnosis, a new case emerging every 66 seconds. What's truly alarming is the possibility that the root cause isn't simply aging, but rather the contents of your medicine cabinet. You've been led to believe that the medications you take are safe, commonplace, and even necessary for your health. However, emerging research is raising serious concerns, indicating that a staggering 99% of seniors are unaware that at least one of their prescribed drugs could lead to a significant reduction of crucial memory centers in the brain by over 28% in less than a year. To put this into perspective, the pharmaceutical industry has been aware of these potential risks for decades, yet continues to generate billions from selling medications that may be hastening cognitive decline in millions of older adults. In fact, a 2023 study published in Neurology and Aging Research revealed that a specific class of drugs increased the risk of dementia by 49% in seniors within just 2 years of use. This video aims to illuminate the 9 most perilous medications that can accelerate memory loss and dementia, presented in order of their potential to cause harm, from the seemingly minor to the profoundly destructive. Even the medication ranked 3rd, commonly prescribed for what might seem like an innocuous condition, has the capacity to shrink vital memory areas of your brain, and its detrimental effects may go entirely unnoticed. Before we delve into the specifics, we invite you to share in the comments which medications you take daily and if you've experienced any sudden episodes of brain fog or forgetfulness. We are actively reading and responding to every comment with personalized insights, as this information could be vital in protecting your cognitive health. Starting our countdown at number 9, and don't let its position mislead you, this common over-the-counter remedy is found in nearly every senior's medicine cabinet and may be subtly impacting your brain before you even realize it. Diphenhydramine, widely recognized as Benadryl, is the pink pill that millions rely on for sleep, allergy relief, or to manage cold symptoms. It's readily available without a prescription and likely resides in your nightstand. While you might be using it for its intended purpose, inside your brain, Benadryl can interfere with the hippocampus, the region essential for forming new memories. Belonging to a class of drugs called anticholinergics, Benadryl works by blocking acetylcholine, a neurotransmitter crucial for memory formation and maintaining alertness. As we age, our brain's reliance on acetylcholine increases, and its disruption by this medication can have severe consequences. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs faced a 54% higher risk of developing dementia compared to their non-user counterparts. To safeguard your memory, it's advisable to avoid any product containing diphenhydramine, particularly those labeled PM, nighttime, or allergy relief, as these often contain Benadryl in disguise. For allergy sufferers, newer, non-sedating alternatives like loratadine, commonly sold as Claritin, are available and do not cross the blood-brain barrier, making them a much safer long-term option for seniors. While it's never recommended to stop medications abruptly, it's equally important to recognize that over-the-counter does not automatically equate to safe. The pervasive presence of diphenhydramine in so many common remedies underscores the insidious nature of its impact. Many individuals do not even recognize Benadryl as the active ingredient in their chosen sleep aid or allergy medication, assuming that because it is readily available, it is inherently benign. This lack of awareness is a significant contributing factor to its widespread use and the silent cognitive erosion it can induce. The reliance on this medication for seemingly minor ailments, such as a mild cough or itchy eyes, belies its potent neurochemical effects. The anticholinergic action, while effective in drying up mucus or reducing histamine response, comes at the significant cost of acetylcholine disruption. Acetylcholine is not merely a neurotransmitter for memory. It is fundamental to attention, learning, and overall cognitive processing. In an aging brain which already faces natural declines in neurotransmitter function, the additional blockade of acetylcholine by diphenhydramine can be particularly devastating. This creates a vicious cycle where the drug, intended to alleviate discomfort or promote rest, inadvertently exacerbates cognitive vulnerabilities. The studies highlighting a 54% increased risk of dementia among regular users are not mere statistics. They represent real individuals whose cognitive faculties are being progressively undermined by a medication found in countless homes. The suggestion to seek out alternatives like Lortidine is crucial, emphasizing that effective allergy relief does not necessitate compromising brain health. It is a call to action for informed consumerism and proactive healthcare choices, urging seniors to scrutinize ingredient lists and seek medical advice for safer, cognition-friendly alternatives. The message is clear. Even the most commonplace remedies demand critical evaluation when it comes to long-term cognitive well-being, and the convenience of over-the-counter accessibility should never overshadow the potential for serious adverse effects on memory and cognitive function. Moving on to number 8, we examine a medication often marketed as gentle and stomach-friendly, yet it can hinder the absorption of vital nutrients essential for maintaining sharp cognitive function. Proton pump inhibitors, or PPIs, such as omeprazole and esomeprazole, are designed to reduce stomach acid and are frequently prescribed for heartburn, GERD, and acid reflux. Many seniors remain on these medications for years, even decades, due to the return of symptoms upon discontinuation. However, a critical yet often overlooked side effect of PPIs is their interference with vitamin B12 absorption. Vitamin B12 is a vital nutrient that supports brain health, memory, focus, and mood stability. A 2016 study published in JAMA Neurology, which analyzed over 73,000 individuals aged 75 and older, revealed that regular PPI users had a 44% increased risk of developing dementia compared to those who did not use them. By excessively suppressing stomach acid, PPIs impair the body's ability to absorb not only B12 but also magnesium and calcium, both of which are indispensable for neural communication and brain cell signaling. A deficiency in these nutrients can lead to inefficient neuronal firing, resulting in confusion and memory lapses that can closely resemble the early signs of Alzheimer's disease. Furthermore, PPIs have been linked to increased levels of amyloid beta plaques in the brain, toxic proteins that disrupt brain function and are a primary driver of Alzheimer's. Fortunately, safer alternatives exist. If you are using a PPI daily, consult your doctor about gradually tapering off with the assistance of H2 blockers like famotidine, sold as Pepcid. While not entirely without their own considerations, H2 blockers are less likely to impact cognition. Additionally, chewing a small amount of deglycyrrhizinated licorice, a natural compound that coats and soothes the stomach lining, may offer symptom relief without cognitive compromise. The long-term reliance on PPIs for conditions like GERD or heartburn creates a situation where the very medications meant to alleviate one set of symptoms inadvertently sow the seeds of cognitive decline. The reduction of stomach acid, while effective in treating acid-related disorders, fundamentally alters the gastrointestinal environment in ways that are detrimental to nutrient absorption. Vitamin B12 in particular requires an acidic environment in the stomach to be released from food proteins and then bound to intrinsic factor for absorption in the small intestine. By neutralizing stomach acid, PPIs effectively sabotage this crucial first step. The ramifications of B12 deficiency are far-reaching, impacting the nervous system directly. B12 is essential for the production of myelin, the protective sheath around nerve fibers, and for the synthesis of neurotransmitters. A deficit in this vitamin can manifest as peripheral neuropathy, cognitive impairment, and mood disturbances. The link between PPI use and a 44% increased risk of dementia, as identified in the extensive JAMA Neurology study, is a stark warning. This risk is not abstract. It translates to a substantial portion of seniors experiencing accelerated cognitive aging due to their medication. The impact extends beyond B12, with impaired absorption of magnesium and calcium also contributing to neuronal dysfunction. Magnesium plays a role in synaptic plasticity, the ability of synapses to strengthen or weaken over time, which is a fundamental process for learning and memory. Calcium is crucial for neurotransmitter release and neuronal excitability. When these vital minerals are not adequately absorbed, the intricate communication network of the brain falters. The connection to amyloid beta plaques is another significant concern. While the exact mechanisms are still under investigation, some research suggests that altered gut microbiota, potentially influenced by long-term PPI use, could contribute to systemic inflammation, which in turn may promote the aggregation of amyloid proteins in the brain. This dual assault, nutrient deficiencies, and potential inflammatory pathways, creates a potent recipe for cognitive compromise. The advice to consult a physician about tapering off PPIs and exploring alternatives like H2 blockers is paramount. H2 blockers, while also reducing acid, do so through a different mechanism and generally have a less pronounced impact on nutrient absorption. Natural remedies like deglycyrrhizinated licorice offer an additional avenue for symptom management without the cognitive risks associated with pharmaceutical interventions, highlighting the importance of a holistic approach to managing gastrointestinal health in seniors. At number 7, we address a medication commonly taken for bladder control, which may be causing significant disruption to both short-term memory and emotional equilibrium. Medications such as oxybutynin, marketed as ditropan, are frequently prescribed to seniors experiencing urinary incontinence or an overactive bladder. While seemingly practical for managing the inconvenience of frequent bathroom trips, this drug functions by blocking acetylcholine, the same neurotransmitter impacted by Benadryl. Unlike some milder anticholinergics, oxybutynin can more readily cross the blood-brain barrier and directly affect the hippocampus, the brain's memory center, making it particularly hazardous for older adults, especially with long-term use. A 2019 study published in the BMJ found that individuals over 65 who took potent medications like oxybutynin for over a year had a 49% increased risk of developing dementia, nearly 1 in 2. The concern is amplified by the fact that many seniors are not informed about these cognitive side effects, being told only about the bladder control benefits, not the potential acceleration of mental decline. This harm is often misattributed to normal aging, with patients reporting feelings of fogginess, forgetfulness of appointments, misplaced items, or difficulty following conversations, rarely linking these changes to their medication until significant damage has occurred. If you are taking oxybutynin and have noticed any cognitive changes, understand that these are not simply in your head, and you do not have to endure these effects to manage bladder control. Fortunately, newer medications like mirabegron, sold as Myrbetriq, operate through a different mechanism and have demonstrated significantly less impact on memory. These drugs do not block acetylcholine and are generally considered safer for older adults. The insidious nature of oxybutynin's impact lies in its targeted yet broad neurological interference. While prescribed to address a specific physiological issue, involuntary bladder contractions, its mechanism of action directly targets a fundamental neurotransmitter system responsible for much more than bladder function. Acetylcholine's role in the hippocampus is critical for the consolidation of new memories, the process by which short-term memories are transformed into long-term ones. When this process is hindered, even seemingly minor memory lapses, such as forgetting where one placed their keys or a recent conversation, can begin to accumulate. The ability of oxybutynin to cross the blood-brain barrier effectively means it bypasses the body's natural defenses, directly impacting neural circuits involved in cognition. This is a critical distinction from medications that have more localized effects. For seniors whose brains are already navigating the natural shifts associated with aging, introducing a potent anticholinergic like oxybutynin can be particularly destabilizing. The BMJ study's finding of a 49% increased risk of dementia among those over 65 who use such potent anticholinergics for over a year is a staggering statistic. It highlights the cumulative effect of these drugs and the significant vulnerability of the aging brain to their detrimental actions. The fact that many seniors are not fully informed about these cognitive risks is a profound ethical concern. The focus on symptom relief without a comprehensive discussion of potential long-term side effects leaves individuals ill-equipped to make informed decisions about their health. The misattribution of cognitive changes to normal aging is a tragic consequence, as it delays intervention and allows damage to progress unnoticed. Symptoms like fogginess, forgetfulness, and difficulty following conversations are not just inconveniences. They are often the early warning signs of drug-induced cognitive impairment. Recognizing these changes as potentially medication-related is the first step towards addressing the problem. The availability of safer alternatives like mirabegron offers a beacon of hope. By operating through a different pathway, these newer medications can provide relief for overactive bladder symptoms without the same cognitive trade-offs, emphasizing the importance of staying abreast of medical advancements and discussing all treatment options with healthcare providers. The message for seniors and their caregivers is to remain vigilant, communicate openly with doctors, and advocate for treatments that prioritize both symptom management and cognitive preservation. Number 6 on our list comprises statins, among the most widely prescribed medications globally, particularly for individuals over 60, with the aim of lowering cholesterol and reducing the risk of heart attacks and strokes. Common examples include simvastatin and atorvastatin, sold under brand names like Zocor and Lipitor. The issue arises because cholesterol is not solely a cardiovascular concern. It is also a brain necessity. The brain is composed of nearly 60% fat, and cholesterol plays a vital role in constructing and maintaining the myelin sheath, a protective coating that facilitates smooth nerve signal transmission. By aggressively lowering cholesterol, you might inadvertently deprive your brain of essential components for its proper functioning. A 2023 study published in Frontiers in Aging Neuroscience indicated that seniors over 70 who had been on statins for more than 3 years experienced a 26% higher risk of mild cognitive impairment, with those on high doses exhibiting even more pronounced declines. More disturbingly, some patients reported sudden memory loss, struggling to recall names, recent conversations, or even familiar driving routes. It is important to note that not all statins affect the brain equally. Some, like pravastatin and rosuvastatin, cross the blood-brain barrier less readily and are considered to pose a lower risk of cognitive side effects. If you have been on a statin for years and are experiencing cognitive fogginess, forgetfulness, or confusion, it may be time to discuss a dose reduction or an alternative strategy with your physician. Delaying action could lead to irreversible damage, whereas prompt intervention can significantly enhance your chances of preserving your cognitive health. The paradox of statins lies in their dual role: life-saving cardiovascular agents and potential cognitive disruptors. While their efficacy in reducing cardiovascular events is well established and life-saving for many, the profound impact on cholesterol levels necessitates a closer examination of their neurological consequences. Cholesterol is not a mere dietary villain. It is an indispensable structural component of the brain. Its presence is vital for the integrity of neuronal cell membranes, facilitating fluidity and the efficient transmission of electrochemical signals. Furthermore, cholesterol is a precursor to bile acids and steroid hormones, but critically for brain function, it is essential for the synthesis of myelin. Myelin, the fatty insulation that wraps around axons, allows nerve impulses to travel at high speeds. Without adequate myelin, neural communication becomes sluggish and inefficient, akin to trying to send signals through frayed wires. The aggressive lowering of blood cholesterol by statins can, in some individuals, lead to a reduction in brain cholesterol levels, thereby compromising myelin maintenance and integrity. The Frontiers in Aging Neuroscience study linking statin use to a 26% higher risk of mild cognitive impairment in seniors over 70, particularly those on higher doses and with longer duration of use, underscores this concern. The reported incidence of sudden memory loss, difficulty recalling names, or disorientation while driving are not isolated anecdotes. They are potential manifestations of compromised neural function. These experiences can be deeply frightening and significantly impact an individual's independence and quality of life. It is imperative to differentiate between statin types, as their lipophilicity, their tendency to dissolve in fats, influences their ability to cross the blood-brain barrier. Statins like pravastatin and rosuvastatin are generally considered less lipophilic, meaning they have a reduced propensity to enter the brain, and thus may carry a lower risk of cognitive side effects. This distinction is crucial for personalized treatment decisions. For seniors experiencing cognitive changes while on statins, the conversation with their physician should focus on a comprehensive review of their cardiovascular risk factors, the necessity of their current statin regimen, and the exploration of alternative lipid-lowering strategies or lifestyle modifications. Prompt intervention is key, as the brain's capacity for repair diminishes with age. Early identification and adjustment of medication can potentially halt or even reverse some of these cognitive detriments, preserving precious cognitive function for years to come. At number 5, we examine benzodiazepines, a class of drugs including lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, widely prescribed for anxiety and sleep disturbances. These medications function by enhancing GABA, the brain's primary inhibitory neurotransmitter, which helps reduce overstimulation. Initially, they can provide welcome relief, quieting the mind, easing panic, and facilitating sleep. However, over time, these drugs can become a significant problem. A 2022 study published in the BMJ, which followed over 8,000 seniors for 6 years, found that individuals who had used benzodiazepines for more than 3 months faced a 51% increased risk of developing Alzheimer's disease. This risk was even higher for long-acting benzodiazepines like diazepam, which remain in the body longer and can accumulate in fatty tissues, including the brain. The mechanism involves a form of chemical sedation that slows neural activity, diminishing the brain's capacity for learning, reducing its flexibility and efficiency, and increasing susceptibility to confusion, memory gaps, and emotional blunting. Seniors on benzodiazepines often report feeling detached, experiencing brain fog, or feeling unlike themselves. Compounding the issue, withdrawal symptoms upon cessation, such as severe anxiety, agitation, and insomnia, can make the drug feel indispensable when in reality, it is the source of the problem. To address this, it is crucial not to stop benzodiazepines abruptly if you have been taking them for more than a few weeks, as this can be dangerous. Instead, work closely with your doctor to gradually taper the dosage. Safer alternatives, such as buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, can help restore calm without causing memory loss. The pervasive use of benzodiazepines for anxiety and sleep disorders, especially among older adults, presents a significant public health concern with profound implications for cognitive health. While these medications offer rapid relief from distressing symptoms, their long-term impact on the brain is a serious consideration. By enhancing the activity of GABA, the brain's primary inhibitory neurotransmitter, benzodiazepines effectively dampen neural excitability. This can be beneficial in the short term for managing panic attacks or insomnia, creating a sense of calm and facilitating sleep. However, chronic exposure to this inhibitory state can lead to profound neuroadaptations. The brain's natural capacity for flexibility and learning, processes that rely on dynamic neural activity, can become impaired. The BMJ study's finding of a 51% increased risk of Alzheimer's disease among long-term benzodiazepine users is a stark testament to this. This is not a marginal increase, it represents a substantial elevation in risk, suggesting that these medications may not only accelerate cognitive decline, but potentially contribute to the underlying pathology of neurodegenerative diseases. The accumulation of long-acting benzodiazepines in fatty tissues, including the brain, is a particular concern for seniors, whose body composition may differ from younger individuals, leading to prolonged exposure and potentially higher concentrations in neural tissues. The subjective experience of seniors on these medications, feeling detached, experiencing brain fog, or a sense of not being oneself, are direct reflections of the dampening effect on neural activity. This can manifest as slowed thinking, difficulty concentrating, and memory deficits that can be mistaken for natural aging, but are in fact drug-induced. The challenge of discontinuing benzodiazepines cannot be overstated. The withdrawal syndrome can be severe, encompassing rebound anxiety, insomnia, restlessness, and even perceptual disturbances. This can create a powerful psychological dependence, making it seem impossible to function without the drug, even as it undermines cognitive function. The advice to taper gradually under medical supervision is paramount to mitigate these risks. Fortunately, a growing understanding of non-pharmacological and pharmacologically distinct alternatives is emerging. Buspirone offers an anxiolytic effect through a different mechanism without the GABAergic sedation. Cognitive behavioral therapy, CBT, for insomnia and anxiety has demonstrated significant efficacy, addressing the root psychological factors without introducing medication-induced cognitive impairment. This multifaceted approach, prioritizing careful tapering and exploring safer alternatives, is crucial for safeguarding the cognitive well-being of seniors reliant on these once common medications. Number 4 on our list is amitriptyline, sold under the brand name Elavil. This older antidepressant, still commonly prescribed today for pain, insomnia, and even migraines, may appear to be a versatile solution. However, beneath its surface lies a potent anticholinergic medication, meaning it blocks acetylcholine, the crucial chemical responsible for neuronal communication, memory formation, and maintaining cognitive sharpness. The effects on cognition are not merely possible but are anticipated with long-term use. A comprehensive 2015 study published in JAMA Internal Medicine involving over 3,400 adults aged 65 and older found that those who had taken higher cumulative doses of anticholinergic medications, like amitriptyline over a 10-year period, had a 54% greater likelihood of developing dementia, a significant increase. Alarmingly, many of these patients were not informed about the drug's potential to harm their memory. Often prescribed for sleep issues or nerve pain, they gradually began to notice changes such as short-term memory loss, difficulty finding words, and impaired concentration. Even low doses of amitriptyline taken nightly over several years can lead to a silent, gradual erosion of brain power, often mistaken for natural aging but actually being drug-induced cognitive impairment. Therefore, if you or a loved one is taking amitriptyline, it is essential to discuss alternatives with your physician. For nerve pain, medications like duloxetine or gabapentin may offer relief without the same level of anticholinergic burden. For sleep, melatonin or a low dose of doxepin, which has a much milder anticholinergic profile, can be considered. For mood support, newer antidepressants such as sertraline or escitalopram are generally considered safer for the brain. Amitriptyline, a tricyclic antidepressant, represents a class of medications that, despite their long history of use, harbor significant anticholinergic properties that can be detrimental to cognitive health, particularly in older adults. Its widespread prescription for conditions extending beyond depression, such as chronic pain and insomnia, means that a large number of seniors are potentially exposed to its cognitive risks without full awareness. The core of the problem lies in its anticholinergic mechanism of action, the blockade of acetylcholine. As previously discussed, acetylcholine is fundamental to memory formation, learning, attention, and overall cognitive processing. When this neurotransmitter is suppressed, the brain's ability to perform these vital functions is compromised. The JAMA Internal Medicine study, highlighting a 54% greater likelihood of dementia in older adults with high cumulative anticholinergic exposure from medications like amitriptyline over a decade, provides compelling evidence of this link. The cumulative effect is key. Even seemingly low doses, when taken consistently over extended periods, can lead to a significant burden on the cholinergic system. This gradual erosion of cognitive function is often insidious. Individuals may notice increasing forgetfulness, difficulty recalling recent events, a struggle to find the right words, or a general reduction in mental sharpness. These changes can be easily attributed to normal aging, leading to a delayed diagnosis or, more tragically, a failure to identify the iatrogenic cause. The lack of informed consent regarding these potential side effects is a critical issue, leaving seniors vulnerable and unaware of the risks associated with their treatment. For those currently on amitriptyline, the path forward involves a proactive conversation with their physician. The good news is that safer alternatives exist for the conditions it treats. For nerve pain, medications such as duloxetine and gabapentin, while not without their own side effect profiles, generally possess a much lower anticholinergic burden. For sleep disturbances, natural options like melatonin, or in some cases, lower doses of medications with milder anticholinergic properties like doxepin can be considered. For depression, newer antidepressants, particularly SSRIs like sertraline and escitalopram, are typically preferred for older adults due to their improved cognitive safety profiles, lacking the significant anticholinergic effects of older tricyclics. The message for seniors and their caregivers is one of empowerment through informed awareness and open dialogue with healthcare providers. At number 3, we discuss paroxetine, commonly known as Paxil. This selective serotonin reuptake inhibitor, or SSRI, is one of the most frequently prescribed medications for depression and anxiety, often perceived as a gentler alternative to older antidepressants. However, paroxetine stands apart from its SSRI counterparts due to its significant anticholinergic properties, which interfere with acetylcholine in the brain. This unique characteristic differentiates it from other SSRIs like sertraline or escitalopram. A substantial 2021 review published in Frontiers in Psychiatry analyzed the cognitive profiles of elderly patients taking various SSRIs and found that paroxetine users exhibited measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also indicated that seniors on paroxetine were 30% more likely to display early signs of cognitive impairment compared to those on other antidepressants. Ironically, while prescribed to stabilize mood, it can undermine mental clarity and emotional regulation over time. The solution here is straightforward yet critical. Avoid paroxetine entirely in seniors. The American Geriatric Society has included paroxetine on its Beers criteria list, a compilation of medications that may be inappropriate for older adults. If you are currently taking paroxetine, consult your physician about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and do not carry the same cognitive risks. Additionally, supplementing with B vitamins, particularly B12 and B6, can support mood naturally. Paroxetine, marketed as Paxil, presents a particularly challenging situation because it belongs to the SSRI class, which is generally considered a safer option for treating depression and anxiety in older adults compared to older antidepressants. However, paroxetine is an outlier within this class due to its notable anticholinergic activity. This means that while it works on serotonin pathways, it also significantly blocks acetylcholine, the critical neurotransmitter for memory and cognitive function. This dual action creates a paradoxical scenario. A medication intended to improve mental well-being can, in fact, lead to cognitive impairment. The Frontiers in Psychiatry review starkly illustrates this concern, identifying measurable declines in short-term memory, verbal recall, and attention span within the first year of paroxetine use in elderly patients. The finding that seniors on paroxetine are 30% more likely to exhibit early signs of cognitive impairment compared to those on other antidepressants is a compelling reason to reconsider its use in this population. This increase in cognitive risk, despite its classification as an SSRI, underscores the importance of looking beyond the broad category of a drug and examining its specific pharmacological profile. The irony of a mood-stabilizing medication potentially leading to confusion and memory loss is not lost on those who experience it. This can exacerbate feelings of anxiety and depression, creating a cycle of distress. The recommendation to avoid paroxetine entirely in seniors is a strong one, supported by its inclusion on the American Geriatric Society's Beers criteria list. This list serves as a critical resource for healthcare providers, identifying medications that may pose a higher risk of adverse events in older adults. For individuals currently prescribed paroxetine, the imperative is to engage in a discussion with their physician about transitioning to safer SSRIs like sertraline or escitalopram. These medications generally lack the significant anticholinergic effects of paroxetine and are better tolerated by the aging brain. Furthermore, supporting overall brain health through adequate B vitamin intake, particularly B12 and B6, can be beneficial for both mood regulation and cognitive function, offering a natural adjunct to pharmacotherapy when appropriate. The message is clear: when it comes to cognitive health in seniors, vigilance and a nuanced understanding of medication profiles are paramount. Our second most dangerous medication is antipsychotics. This is particularly concerning because many seniors are unaware they are even taking these drugs. Medications like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed to treat severe psychiatric conditions like schizophrenia and bipolar disorder. However, they are now frequently prescribed off-label for elderly patients to manage sleep problems, agitation, or behavioral changes associated with dementia itself. This means drugs intended for severe mental illness are being administered to seniors who are simply confused, restless, or difficult to manage in nursing homes and hospitals. The consequences are devastating. A comprehensive 2022 study in The Lancet Healthy Longevity tracked over 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even if they had no prior history of dementia. Furthermore, these drugs increase the risk of stroke, sudden death, and severe sedation, which can lead to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, a neurotransmitter vital not only for mood and motivation, but also critical for executive functions and memory processing. When dopamine levels plummet, the brain becomes sluggish and unresponsive, leading seniors on antipsychotics to appear dulled, emotionally flat, or almost zombified, with their personalities fading, leaving families to mourn individuals who are still physically present. Addressing this situation requires asking difficult questions. If you or a loved one is on one of these medications, inquire about the reason for its prescription and whether it is truly necessary. In many instances, behavioral symptoms can be effectively managed through non-drug interventions, such as establishing structured routines, reducing sensory overstimulation, addressing pain or discomfort, and improving lighting and sleep hygiene. When medication is unavoidable, using lower doses for shorter durations can mitigate harm. However, in numerous cases, these drugs are utilized for convenience rather than necessity. The tragedy is that many families are not informed about the adverse effects of these medications, simply observing their loved ones decline without understanding that the cause is chemical, not natural. The off-label use of antipsychotics in the elderly population for behavioral management represents a critical and often overlooked threat to cognitive health and overall well-being. These powerful medications designed for severe psychiatric conditions are being inappropriately deployed to address challenging behaviors in seniors, often in institutional settings. The rationale behind this practice, while sometimes stemming from a desire to manage disruptive behavior, frequently bypasses more nuanced and often more effective non-pharmacological interventions. The consequences, as highlighted by the extensive study in the Lancet Healthy Longevity, are dire. A 71% increase in worsening cognitive decline within 12 months for seniors prescribed antipsychotics for behavioral symptoms is a staggering figure, particularly when it affects individuals who may not have had pre-existing cognitive issues. This indicates that these drugs can actively accelerate neurodegeneration or induce significant cognitive impairment. The mechanism of action involving the suppression of dopamine is central to this deleterious effect. Dopamine is not merely a pleasure neurotransmitter. It plays a crucial role in executive functions, including planning, decision-making, working memory, and motivation. A significant reduction in dopamine activity can lead to a profound blunting of cognitive and emotional responsiveness, creating the distressing zombified effect that families often observe. This not only diminishes the individual's quality of life, but also fundamentally alters their personality and sense of self, leaving loved ones grieving for a person who is still physically present, but cognitively and emotionally diminished. The lack of awareness among seniors and their families about these risks is a major contributing factor to their widespread use. The tragedy lies in the fact that many behavioral issues in dementia can be effectively managed through environmental adjustments, personalized care strategies, and addressing underlying physical discomforts like pain, hunger, or dehydration. When medication is deemed necessary, the focus should be on the lowest effective dose for the shortest possible duration, with careful monitoring for adverse effects. However, a concerning trend is the use of these drugs as a form of chemical restraint or for the convenience of caregivers, rather than as a last resort. This highlights a systemic issue within elder care that demands urgent attention, emphasizing the need for greater education, advocacy, and a shift towards person-centered, non-pharmacological approaches to care. Finally, at number 1, we identify the hidden danger that is rarely discussed and represents one of the most significant contributors to drug-induced dementia in the elderly: anticholinergic polypharmacy. You might expect a single drug to top this list, but the most perilous medication for rapid dementia in seniors is not a solitary pill. It is the insidious, cumulative effect of taking multiple medications with anticholinergic properties. Concurrently, a condition known as anticholinergic polypharmacy. Consider a scenario where a senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Individually, each of these might cause only mild memory problems. However, when combined, their effects are compounded, leading to a dramatic increase in the cumulative anticholinergic burden. This is not merely a theoretical concern. A 2022 analysis published in Age and Aging, which monitored over 280,000 older adults, revealed that those with the highest anticholinergic burden faced a 120% increased risk of developing dementia within 10 years, more than double the average risk. The most alarming aspect is that most of these seniors were unaware they were even taking anticholinergic medications. When acetylcholine is blocked from multiple pathways simultaneously, the brain does not merely slow down, it begins to deteriorate. Neurons atrophy from disuse, synapses shrink, and the brain enters a hypoactive state that closely mimics Alzheimer's disease. Correcting this does not require a miracle. It requires a comprehensive medication review. Ask your doctor or pharmacist to assess your complete list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. Online tools and professional software are available to calculate this cumulative burden. Once identified, you can work towards deprescribing, gradually tapering off unnecessary medications, transitioning to safer alternatives, and rebalancing brain chemistry. This is the most empowering aspect of this entire video. Drug-induced dementia is often reversible. When the burden is lifted, many seniors experience a return of clarity, energy, and memory function within weeks or months. The brain possesses remarkable resilience, but only if it is given the opportunity to heal. Polypharmacy is not just dangerous, it is preventable, making it the foremost hidden medical threat to the cognitive health of our aging population. We are eager to hear from you. Which of these medications are you currently taking? Have you noticed any brain fog, forgetfulness, or personality changes since starting a new medication? Are you prepared to discuss reviewing your medications with your doctor this week? Please share your experiences and opinions in the comments below. We are keen to learn from you. Thank you for watching. Anticholinergic polypharmacy stands as the zenith of medication-induced cognitive risk for seniors because it represents a synergistic assault on the cholinergic system. It is not the presence of a single anticholinergic drug that poses the greatest threat, but rather the cumulative effect of multiple medications, each contributing its share to the overall burden. Imagine a senior taking several common medications, each with even a mild anticholinergic profile. A diphenhydramine-containing sleep aid, an overactive bladder medication like oxybutynin, a tricyclic antidepressant like amitriptyline for pain, and perhaps even certain antihistamines or antispasmodics. Individually, these might be considered manageable, with their side effects perhaps attributed to other factors or deemed a reasonable trade-off for symptom relief. However, when taken concurrently, their anticholinergic effects do not simply add up, they multiply. This synergistic interaction significantly amplifies the blockade of acetylcholine, leading to a profound disruption of cognitive processes. The Age and Aging analysis, revealing a staggering 120% increased risk of dementia over 10 years for those with the highest anticholinergic burden, serves as a stark warning. This level of risk elevation is profound and directly implicates polypharmacy as a primary driver of cognitive decline. The fact that most seniors are unaware of the anticholinergic nature of all their medications is a critical gap in patient education and healthcare communication. Many are prescribed these drugs by different specialists, with little overarching oversight to assess the collective impact. The consequence of this widespread, unacknowledged anticholinergic load is the gradual deterioration of brain function. Acetylcholine is essential for synaptic plasticity, the formation of new connections between neurons, and the efficient communication between them. When acetylcholine is consistently blocked, these processes falter. Synapses begin to weaken and eventually atrophy from lack of use. Neurons, starved of the signals necessary for their function, enter a state of hypoactivity. This leads to a widespread reduction in neural network activity, manifesting as the hallmark symptoms of dementia. Memory loss, impaired, executive function confusion, and disorientation. The crucial message of hope lies in the reversibility of drug-induced dementia. Unlike neurodegenerative diseases that progress relentlessly, the cognitive impairment caused by anticholinergic polypharmacy is often treatable. The key is a comprehensive medication review, a process that involves meticulously cataloging all medications, including over-the-counter drugs and supplements, and assessing their anticholinergic load. This can be facilitated by healthcare professionals using specialized tools and databases. Once identified, the goal is to deprescribe, to safely and gradually eliminate unnecessary medications, substitute them with safer alternatives, or reduce dosages. When this burden is lifted, the brain, with its remarkable capacity for healing, can begin to recover. Many seniors experience a significant return of cognitive clarity, improved memory, and enhanced mental acuity within weeks or months of reducing their anticholinergic exposure. This underscores the critical importance of proactive medication management and open communication between patients, caregivers, and healthcare providers. Empowering seniors with this knowledge is essential to combating this hidden epidemic and preserving cognitive health for as long as possible.